Good evening, folks. I have discussion D for you. We're discussing advanced care planning tonight for D. Advanced care planning, ACP, is a proactive process that helps individuals articulate their healthcare preferences before a medical crisis occurs, ensuring that their values and wishes are respected, even if they're unable to communicate them later. The surrounding page content and featured videos emphasize that ACP is not just for the elderly or terminally ill. It's relevant for adults of all ages. Here's how the concept is unpacked across the highlighted resources. Empowering patients. Advanced care planning, how it benefits patients. Explains how ACP enables individuals to make informed decisions about future medical care. Improves communication between patients and their providers, and ensures compliance with the patient's care plan. It also highlights how ACP supports end-of-life preferences, giving patients control over critical choices. Collaborative decision making. Advanced care planning underscores the importance of partnership between healthcare teams, patients, and families. It encourages open discussions about medical options and care decisions, fostering trust and clarity, understanding the process and legal tools. What is advanced care planning? Why is it so important? And dives into the role of legal documents like healthcare directives and my health record. It explains how sharing ACP documents ensures that care teams can access and honor a patient's wishes, facilitating meaningful conversations. How to have an advanced care planning discussion with family. Offers guidance for clinicians on how to approach ACP discussions with empathy, using open-ended questions and respectful exploration of values. This helps build trust and ensures that conversation is patient-centered, clarifying goals and timing, understanding advanced care planning, and important outlines where and how to begin, ACP, who should be involved, and what documents to complete. It also introduces concepts like poll list, and power of attorney. Helping viewers understand the broader legal and ethical landscapes. Real life impact. Advanced care planning, a care's story, shares a personal narrative that illustrates the emotional and practical benefits of ACP. It shows how documenting and sharing care preferences can reduce stress and confusion for loved ones during difficult times. It's in essence the page and its featured content advocate for ACP as a compassionate, empowering, and essential part of healthcare. It's about planning for the what it's about planning for the what it's with clarity and dignity so that care aligns with personal values even when voices can't be heard. Advanced care planning offers a wide range of benefits, not just for individuals. Facing serious illness, but for anyone who wants their healthcare preferences respected. Here is a breakdown of the most evidence-based and impactful advantages. Key benefits of advanced care planning for individuals. Clarity and control helps you define what matters most, your values, goals, and preferences for care. So decisions reflect your wishes even if you can't speak for yourself. Peace of mind reduces anxiety about future medical scenarios by ensuring your voice is heard and respected. Improve quality of life, prevents unwanted hospitalizations, and promotes use of palliative care and hospice when appropriate. For families, reduces burden, eases the emotional stress of making difficult decisions during crisis by providing clear guidance. Better bereavement outcomes. Families report less stress, anxiety, and depression after a loved one's death. When ACP is in place, enhanced satisfaction improves family understanding and satisfaction with end of life care. For healthcare providers and systems, patient centered care encourages meaningful conversations that align treatment with patient values. fewer intensive interventions, reduces use of aggressive treatments and ICU admissions and at the end of life. Cost savings lowers healthcare costs by avoiding unnecessary procedures and hospital stays. Legal and ethical clarity ensures compliance with documented wishes, reducing moral distress among care teams. Advanced care planning is ultimately a gift to yourself and to those who may one day need to speak on your behalf. It transforms unnecessary into clarity, uncertainty into clarity, and empowers everyone involved to act with confidence and compassion. Would you like help designing a culturally responsive ACP toolkit or conversation guide for specific community? I'd love to co-create something with you. Advanced care planning, ACP, is more than filling out form. It's a thoughtful, values-driven process that unfolds in stages. Here's a clear, actionable breakdown of the key steps involved based on trusted sources like the National Institute on Aging and UW Medicine. Steps in advanced care planning. Reflect on your values and goals. Consider what matters most to you in life and in healthcare. Ask yourself, what does a good day look like? I'm seriously ill. What do I want to avoid? Think about cultural, spiritual, or personal beliefs that shape your preferences. Learn about medical options. Understand common treatments like CPR, ventilators, feeding tubes, and palliative care. Explore how these options align or conflict with your values. Consider scenarios like terminal illness, dementia, or sudden injury. Choose healthcare proxy. Select someone you trust to make decisions if you're unable to speak for yourself. This person should understand your values and willing to advocate for your wishes. Document this in a durable power of attorney for healthcare. Document your wishes. Complete legal forms like living wills. Specifies treatments you want or don't want. Advance directives combines your living will with proxy designation. Some states also use PO list, physician orders for life-sustaining treatment for those with serious illnesses. Talk with loved ones and your care team. Share your decisions with family, friends, and healthcare providers. Use conversation guides or worksheets to make it easier. These discussions reduce confusion and emotional burden later. Store and share your documents. Keep copies in accessible places, e.g., with your proxy, in your medical record, or upload to Health Portal. Make sure your care team knows where to find them in an emergency. Review and update regularly. Revisit your plan after major life changes, new diagnosis, marriage, loss, or aging. Update documents and communicate changes to your proxy and providers. Advanced care planning is a living process. It evolves as your life and values do. If you're designing culturally responsive ACP materials or toolkits, I'd be thrilled to help tailor these steps for your specific communities or care settings. Want to co-create a framework. Advanced care planning is often misunderstood even by well-meaning professionals and families. These conversations are led to confusion during medical crisis. Let's bust some of the most persistent myths. Okay. Give me 1 second, guys. Common misconceptions about advanced care planning. Myth 1: it's only for elderly or terminally ill. Truth: ACP is for everyone, regardless of age or health status. Accidents and sudden illnesses can happen at any time. Planning ahead ensures your wishes are known and respected. Myth 2: I need a lawyer to complete an advance directive. Truth: most states allow you to complete advance directives without legal assistance. Forms are freely available online and often just require witness or notarized. Myth 3: if I name a healthcare proxy, I lose control over my decisions. Truth, you remain in charge as long as you're able to communicate. Your proxy only steps in if you're incapacitated. Myth 4. Advanced care planning means refusing aggressive treatment. Truth, ACP is about your preferences, whether that's full intervention or comfort focused care. You can choose at any level of treatment and update it as your values evolve. Myth 5. Once I complete the forms, I'm done. Truth, ACP is a living process. You should revisit your documents regularly, especially after major life changes. Make sure your care team and loved ones have updated copies. Myth 6. I have to predict every medical scenario. Truth, you don't need a crystal ball. What matters most is communicating your values, goals, and general preferences. These guide your proxy and clinicians when specifics arise. Myth 7. There's only one type of advance directive. Truth, there are several types. Living wills, durable power of attorney for healthcare, polis, and more. Each serves as each serves a different purpose depending on your health status and state laws. These myths can be especially harmful in marginalized communities where mistrust or lack of culturally tailored resources may already hinder engagement. If you're developing myth busting materials or toolkits, I'd love to help co-create virtuals, conversation guides, or culturally responsive adaptations. Want to sketch out a framework together? Absolutely. Advanced directives come in several forms, each serving a distinct purpose in ensuring that healthcare decisions reflect a person's values, especially when they can't speak for themselves. Here's a clear breakdown of the main types. Types of advanced directives, type, purpose, and when it's used. Okay, living will specifies which medical treatments you want or don't want, e.g., life support, feeding tubes when you're terminally ill or permanently unconscious. Verbal power of attorney for healthcare, aka medical POA, appoints a trusted person proxy to make healthcare decisions on your behalf when you're unable to make or communicate decisions. Do not resuscitate order, DNR. Do not innovate. DNI states you don't want CPR or intubulation. If your heart or breathing stops, used in emergencies or hospital settings. POLST, or MOLST, physician medical orders for life-sustaining treatment, medical orders that reflect your wishes for specific treatments like antibiotics, IV fluids, or resuscitation for seriously ill or fatal frail individuals, used by emergency responders. Optional but valuable additions. Organ donation directive. Indicate your wishes about donating organs or tissues. Value statement. A personal narrative that explains your belief, goals, and what quality of life means to you. HIPAA release forms allows designated individuals to access your medical records. Each document plays a role in building a comprehensive care plan. For example, a living will outlines specific treatments, while medical POAs ensure someone can make decisions in unforeseen situations. Okay, guys, so those are the shows for tonight. I will see everybody tomorrow for shows. For now, Gator Wellness, take care, folks.